So Aideen from Belfast is going to talk about changes in self-harm presentations and suicidal ideation in Northern Ireland.
Thanks, Rob, and thanks, Marcos, because I think a lot of what I'm presenting here will just be what you've presented, but from a Northern Ireland context. So just to give a bit of background, the data used in Northern Ireland for this particular analysis is from the National Register of Self-Harm and Suicide Ideation, which is a population-wide register of all presentations to emergency departments in Northern Ireland for self-harm or suicide ideation. It also includes individuals who go on to be admitted, but it's just if you turn up at an emergency department, either claiming that you have suicidal thoughts or if you present with self-harm, then you'll be on this register. So a bit of context, I suppose it's not really needed for this group as to why we're interested in this research, but we've seen across news headlines at the moment quite a lot of sort of doomsday predictions about this tsunami of mental illness that is coming post-COVID-19 pandemic. And we are seeing that particular suicide charities and psychiatrists and physicians are fearing that there'll be a massive mental health problem after the peak of the pandemic ends. And we've also seen some reports in the media about self-harm amongst young children increasing and emergency departments seeing more individuals presenting with self-harm. But what you've seen, I suppose, from Marco's presentation and what other literature across Ireland also presents is that there's no evidence of increased hospital presenting self-harm at a population level. We see a decrease in the first couple of months and then a return to sort of normal or expected levels. There's no evidence of increased self-reported self-harm thoughts in the UCL population surveys that have been carried out throughout the pandemic. And there's no sort of consistent evidence of increased self-harm or suicidal behaviour. But within the Northern Ireland data, we wanted to ask, well, what effect did the COVID-19 pandemic have on presentations for self-harm and suicide ideation in Northern Ireland? For the first few months of the pandemic, we had weekly counts, weekly counts for numbers of presentations each week. So we were able to do some trend analysis to explore observed versus expected values. Now, the register began in 2012, which means that we've got about 9 to 10 years of data within this registry, which means that we can look at trend analysis. And for this particular analysis, we did ARIMA models. Lisa, who's on the call here too, Lisa Kent, actually did the analysis for this. But if we just look at raw counts, what we're most interested in, I suppose, was from the beginning of the pandemic, March 2019, in the first sort of 7 months that we had data for. This is the, or March 2020, sorry, so that we had data for. So this is the numbers of weekly presentations from March 2019 to September 2019. And you can see that pre-pandemic, there is sort of weekly variation, but presentations sort of are between 200 to 300 per week. When we overlay this with the 2020 numbers, which are the red bars here, we can see that for the first sort of 7 or 8 weeks, the red bars are lower than the blue bars, so they're less than the year before. But after that, the trend sort of returns to as expected. We see a little bit of over adjustment in these few months where we have more than expected presentations or more than the previous year, but it's nothing out of the ordinary. And this is just comparing actual numbers. When we plot weekly numbers over the full 9-year period, we can see that weekly presentations for self-harm or suicide ideation have been on an upward trend in Northern Ireland for the last 9 or 10 years. We see this drop, which is in the March stay-at-home order from the pandemic, and we see that the presentations remain low for the first few months and then sort of return to normal. When we separate out self-harm and suicide ideation, the self-harm is where you present with actual physical harm. Suicide ideation is just where you present without any harm, but with thoughts of self-harm or thoughts of suicide. We see that over the last 8 or 9 years, that rates of suicide ideation have been increasing more steeply. So this is the red line, but also rates for self-harm have been increasing as well. Now we see a similar drop in both. There doesn't appear to be much difference in them, and then a return to normal about 8 or 9 weeks later. In order to examine this in more detail, not just looking at raw numbers, we ran ARIMA models. So this was looking at the previous sort of 8 years trend to predict what the observed or what the predicted numbers for each week should look like. And this is the black line in this graph. So this is from March, so the beginning of the pandemic, March 2020 to September 2020. The black line is our predicted numbers of presentations based on the previous 8 years. The dark grey and light grey are your sort of 95% and 80% confidence intervals. The red line are actual observed numbers of presentations. And we see that again in these first few weeks, the red line's below the black line, which means that our observed is lower than expected. But after that, numbers tend to return to normal. So this is just overall weekly presentations for both. So this is just total numbers. This is not looking at individual subgroups. And I suppose one of the main questions is, well, we have been looking at the news headlines and the suggestions are that there are an increase in presentations and individuals are in emergency departments saying we're seeing more presentations for self-harm than ever before. And based on what Marcus presented previously, a reason for this may be that the proportion of individuals presenting with self-harm are actually higher than the proportion with other ailments, so that it just appears that there's more with self-harm more than usual. Or it may be that the physicians are seeing more, but we just can't see it from this top level data. So what we did was we looked at individual hospitals in Northern Ireland. And I'm going to present information here just for the 4 main hospitals. So we're looking at presentations per hospital to see if there was variation in different hospitals. So we're looking at the 4 largest hospitals here. This is the results for Altnagelvin Hospital, which is in Derry. And we see this decrease for the first 7 or 8 weeks and then a return to normal, a little bit higher in some of the later weeks around here, but nothing that's falling consistently out of the prediction lines. And again, this is for Ulster Hospital, which is in South Belfast, and there's not much difference in predicted versus observed presentations here, a little bit lower for the first few weeks. But when we look at Craigavon Hospital, we see that the numbers of presentations in the first few weeks actually are within the expected levels, and there is an increase above the line during the rest of the pandemic. And this graph here shows the Royal Victoria Hospital, which is the largest hospital in the centre of Belfast, and we're seeing a large increase in presentations here. And one of the reasons for this is likely because the neighbouring hospitals to these, Daisy Hill, which is the neighbouring hospital, Craigavon, was closed during the pandemic. Its emergency department closed completely. And the closest hospital to the Royal Victoria Hospital, the Mater Hospital, became a COVID centre and its emergency department closed. So what we're likely seeing here is not an overall population increase in self-harm, just a diversion of presentations from one hospital to another. So the second question we wanted to ask is, well, within those who are presenting, did the presentation profile change during the pandemic? So we've got full data on presentations from 2012 to September 2020. And the idea was to do trend analysis, looking at raw numbers and ARIMA models to explore variation by gender, age, method, etc. So this is just our graph again by gender, looking at presentations over the full 8-year period. Blue is male, orange is female. We see that the drop is equivalent for males and females during April. We ran ARIMA models and we see that the drop is the same for both. So there's no variation by gender. It's not that all the females stop presenting with self-harm and all the males continue to present. There is an equal drop in both categories. When we look at presentations by age over the 8 or 9 year period, we see that the 2 blue lines at the bottom here are aged less than 15 years is the dark blue, and the light blue is aged over 65 years. So the extremes of age presenting with self-harm, we see that there's not really much difference. So we don't see the massive drop that we see in the other age groups. The grey here is 25 to 44, orange is 16 to 24, and yellow is 45 to 46, where we see this predicted drop in March, April time, and then a return to normal. It seems that for the older, very old and the very young, that the pandemic didn't really have much of an impact on presentation patterns. The largest drop was observed in the 45 to 64-year-olds, where we see 50% lower than average presentations in March and April time. Smallest drops, like we said, in the extreme age groups. And actually after May, we begin to see the under 15 age group increasing. And this is just looking at raw numbers. We looked at the ARIMA models to see if it held, and we can see this is the ARIMA models for the 16 to 24 age group, 25 to 44, 45 to 64. So all those middle ages, we see the massive increase March, April time and a return to kind of as expected levels. But In the over 65 age group, it stays within the grey bars. Our presentations never go lower than expected. And for the under 15s, what we're seeing coming out of the pandemic in July, August, September time is that presentations are higher than expected. And I suppose this would support the evidence that we're seeing in emergency departments where physicians are claiming they're seeing more younger people presenting with self-harm. When we look overall at self-harm by itself versus suicide ideation only, we see that this usual trend of the drop in March and April time and a return to normal or expected presentations for self-harm. But for suicide ideation, the presentations continue to be a little bit lower than expected during the pandemic. We looked also by method, looking at those who present with overdose compared to standard sort of self-cutting, compared to the more severe methods, hanging, strangulation, jumping from a high place, other methods in grey at the bottom here. And we see that the same sort of massive drop for overdose that you see in the overall data, which isn't as big for cutting or for hanging. See, numbers for overdose and cutting continue to be lower than average, but numbers for strangulation or hanging appear to be 30% higher than the average 7 months into the pandemic. This is just looking at numbers comparing average in the previous years to average in the year during the pandemic. But whenever we put this into your EMA models, we see that overdose is actually within the expected levels. You see the red line here falls mostly within the grey boxes. Hanging and the more severe methods are also within expected levels as would be predicted given the previous year trends, and as cutting. So although the raw numbers give one number, when you put it into the actual models, it appears that the presentations are as expected. So did the presentation profile for self-harm and ideation change during the pandemic? So although the nationwide data looks like there was a drop for 2 months and then a return to normal, the profile of who is presenting has changed dramatically during the first 7 months. Suicide ideation is much lower than expected. There's a decrease in self-harm and suicide ideation in those aged 16 to 64 years, but an increase in those aged under 15, under 16, 15 and under. We see a slight decrease in overdose presentations, which is sort of balanced by a slight increase in more extreme methods, but that seems to have been on the trajectory for the trend anyway. And we see massive variation by hospital, which is explained by closures of hospitals during the pandemic. Now, just a bit of also additional information. The idea was to look at self-harm and suicide ideation as a proxy indicator of mental ill health to see what impact the pandemic has had on mental ill health. And we see that we're not seeing this massive increase in self-harm presentations or suicide ideation presentations. We also explored psychotropic medication uptake, and we can see that we're also not seeing a massive increase in psychotropic medication over the first 7 or 8 months of the pandemic. So this fear of a tsunami of mental ill health is not being actualized in actual seeking of services or uptake of medication. Which begs the question, will it exist, will it materialize, or is it just that we're seeing a lack of help-seeking behaviour? The next steps in this study are to explore in more detail the characteristics of those who continue to present. So we've got additional information from the Registry of Self-Harm on time of presentation and on next care. We want to explore the characteristics of who stopped presenting. So with individual level data here, we can see who were those individuals that presented up until March 2020 and then it didn't appear again. We'll explore then to see do those individuals go on to die by suicide or any other cause of mortality during and after the first initial lockdowns of the COVID pandemic. Some acknowledgements there, and that's me.